Hi, and welcome to my presentation on functional treatment planning for liver stereotactic body radiation therapy. External beam radiation therapy is a type of cancer treatment that uses beams of intense energy to kill cancer cells by damaging their DNA. The ultimate objective of radiation therapy is to target the tumor while sparing the healthy or normal tissue. Stereotactic body radiation therapy, or SBRT, is one such technique which uses an extremely high dose of radiation, up to 5 times the conventional dose. By upping the dose, it reduces the overall treatment time from 30 treatments to 5 or less. The increased dose in SBRT treatment is both effective and, due to fewer appointments, it puts less of a burden on the patient and the healthcare system. The high dose associated with SBRT, while effective, introduces the risk of radiation-induced liver disease, RILD, when used to treat liver cancer. RILD can present as a variety of unpleasant symptoms or even result in death. To prevent RILD, a certain amount of healthy liver tissue must be spared, as the functional liver tissue is what maintains a patient's quality of life and allows the liver to do its job. Certain regions of the liver may be of more interest when it comes to sparing the liver tissue, as the liver function may not be uniform throughout the organ. There may be areas of high function or areas of low function, as seen in the image. There is a novel technique called functional treatment planning, where individualized radiation treatment plans are specifically designed to spare highly functional liver tissue. This is compared to the conventional technique, which assumes the liver to have uniform functionality and doesn't prioritize the important high-functioning tissue and puts the patient at higher risk. Functional treatment planning could potentially aid in reducing toxicity and create better patient outcomes by sparing that functional part of the patient's liver. It could allow for more patients to qualify for SBRT, as we would be able to ensure that the healthy part of the liver is spared, and thus riskier patients could safely undergo the treatment. Functional treatment planning, however, is fairly time-consuming, which is why it's important to determine which patients would significantly benefit so the clinic's resources can be devoted to cases where the extra effort would actually make a significant impact on the patient. The goal of this project was to determine a framework for how the volume of the functional liver impacts patient outcomes. This framework would help for future patient selection to determine which patients would see a significant impact from functional treatment planning. The first step in the methodology was to define functional liver regions of varying sizes for 11 patients by varying the threshold for what was considered to be functional. The functionality of the liver was defined by using the pixel intensity of a contrast-enhanced MRI. The next step in functional treatment planning was achieved using a clinical software such that each functional liver region will be used to create an individualized treatment plan. This software is capable of taking an input of dose constraints for the delineated areas of interest and finding an optimal way to angle and shape the beams of radiation to achieve the suggested goals. This is known as the radiation treatment plan. For functional treatment planning, sparing the functional liver region was set as the priority dose constraint for the optimization. This can be compared to the conventional treatment planning, which would not include this constraint. The software finds the best possible treatment plan and outputs the predicted raw data about the dose to each structure of interest. We looked at 42 different parameters to describe the overall success of the treatment plan based on the ability to target the cancerous region while sparing the surrounding organs and functional tissue. What we found was that using functional treatment planning, we were able to achieve equivalent results to the standard treatment planning technique. This is quantified by confirming that the radiation dose distribution was sufficiently conformed to the shape of the tumor, and the target received the prescribed dose, and the surrounding organs were spared. These results were not dependent on the volume of the functional liver region, which indicates that regardless of how big or small a patient's functional liver region is, that functional treatment planning at the very least will not compromise the basic treatment standards. For evaluating the ability to spare the functional liver region, the dose to the functional liver region was compared for each functional plan and a conventional plan to see if there was a sufficient difference in the ability to spare the functional region. The percent of the volume of the functional liver region receiving more than a safe dose of 15 gray was sufficiently different for FLR values between 0.15 and 0.85. FLR was a parameter that we defined as the volume of the functional liver region over the volume of the total liver. Within this range, it was possible to spare between 5.2 and 7.2% more of the functional liver tissue, which would help improve a patient's quality of life. This gives an interval of FLR values where the increased workload associated with functional treatment planning shows a significant enough benefit in the ability to spare the functional tissue for the patient to be considered for functional treatment planning. Thank you for attending my presentation. I really appreciate it.